Good afternoon. I'm Dr. Bonnie Henry, the Provincial Health Officer for British Columbia, and today, for July 17th, this is our update on COVID-19. I'd like to start by acknowledging with gratitude that we're on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nations, and we're grateful to be able to present from these territories today. While we had not planned to have a media briefing this afternoon, there have been a number of developments in different areas of the province over the last couple of days that I believe are important to address in person, so I can answer any questions that are brewing and that have come up and make sure that we can give some important messages for people as we head into another summer weekend. But to start with, we have 28 new cases in British Columbia today. That gives our total to 3,198 people who have COVID-19 in British Columbia. That includes 1,032 people in the Vancouver Coastal Health Region, 1,676 people in Fraser Health Region, 136 people on the Vancouver Island Health Region, 235 people now in Interior Health Region, 68 people in the Northern Health Region, and 51 people who are from outside of Canada. We have 207 active cases, of whom 18 are in hospital now, 2 of whom are in intensive care or ICU. We have no new deaths to report. Our total remains at 189 people who have died from COVID-19. And we have 2,802 people who are now fully recovered. There has been, however, one new healthcare-associated outbreak, and that is at the neonatal intensive care unit at St. Paul's Hospital in Vancouver. I will say that the maternity unit remains fully operational, and a backup, separate NICU, as we call it, our neonatal intensive care unit, has been set up at St. Paul's so that infants and families can continue to safely receive the care that they need. Contact tracing is ongoing to understand how the virus was introduced into people in the NICU, and Vancouver Coastal Health is investigating with St. Paul's and with the staff there and to ensure we have identified everybody. There are a number of families and staff who have been contacts who are now isolated, and the families involved, everybody involved is right now being monitored carefully by Vancouver Coastal Health. On the positive side, in terms of healthcare facility outbreaks, the outbreak at Maple Hill long-term care facility in the Fraser Health Region has now been declared over, so that is good news. We have 3 active outbreaks in long-term care, 1 in long-term care, as we've said, and 2 now in acute care, so that the Mission Hospital and now St. Paul's. We have a total of 401 residents and 255 staff who have been affected in our healthcare facility outbreaks. So we do have some progression as well in some of our community outbreaks and clusters that we've been following. There are now 4 cases connected with the Crazy Cherry Farm in the Interior Health Region, and public health teams continue to monitor and support the staff and the farm family in that area. One of our new cases reported today is a worker from Alberta who is a worker at the Site C work camp in the Northern Health Region. As we know, these have been areas that we have had concern about from the very beginning of this, and we have ongoing plans with industrial camps, particularly in the north, recognizing that there were essential work that needed to be done at those facilities. And BC Hydro has been following all of the protocols. The person who was identified had their exposure in a test in Alberta. They are in isolation, and public health teams are working closely on site and monitoring the situation. A very small number of contacts have also been identified and have been isolated and are being monitored. And I think it's important to recognize that this person had very limited contacts after their recent return to the camp, and immediately identified when they were notified that they had a positive test. They have had no contact with any of the communities around that area. So I think that says to us that the protocols that we have in place have worked, and that they're being followed carefully. So that is good news. Vancouver Coastal Health will also be, or has also issued an alert for potential community exposures at the Sandman Suites Hotel on Davie Street between July 7th and July 16th. And that is part of the ongoing investigation in Vancouver Coastal Health. And so, as a precaution, anyone who may have been exposed is required. We need you to monitor yourself carefully for any symptoms. Limit your contact with others over the incubation period and contact 811 immediately to arrange for testing if any symptoms develop. Also, to complicate our Friday, we're now up to 35 cases associated with the community exposure events in and around Kelowna, BC, starting around Canada Day in the following week. And this is one of the more concerning issues to us because we recognize that there have been a number of events that have happened there, and we need people to start thinking about how we can socialize safely over the coming weeks. We anticipate that there will be more cases in the coming days as people who were exposed are now starting to develop symptoms. And Interior Health is working very carefully and very closely with a number of the events where these were happening and following people. As you know, with this virus, once you have been exposed, there's nothing we can do to prevent you from developing disease. We just need to wait it out and ensure that if you do get sick, that you are not passing it on to others. And that's how we break those chains of transmission. We did have a meeting today, and I'm very thankful for this opportunity to come up with a plan with the Mayor of Kelowna, Colin Basran, and his team, with MLA Norm Letnick, Minister Dix, the CEO of Interior Health, Susan Brown, and Dr. Sylvina Mema, the MHO in the area. And we have a number of things that we're going to do to work with the communities in the central Okanagan to make sure that we can help people safely enjoy the rest of this summer. While public health teams have been extremely effective in identifying and containing transmission, these flare-ups in our communities around the province are a concern. It is not necessarily unexpected, but it is a warning to us that we need to do more to keep things in balance. This is one of the reasons that I felt it was important to speak today. Many of these new cases are people in their 20s and 30s, and transmission is directly connected to those very important social events. We know that gathering helps us feel connected and hopeful in these challenging times. And we want to be able to continue to do that. And we also are aware that while the severity of illness for those people in our 20s and 30s, or I should say in your 20s and 30s, are typically much less. And people may not recognize that they are ill or that they have mild symptoms, but they can still spread the virus to others. And your ability to spread that virus is just as high or higher as older people. And recently I had the opportunity to take over Olivia Munn's social media accounts, something that I'm not particularly adept at, but it was a great experience. I'm not typically active on social media, but I certainly understand the value of social networks. And now I am asking you to be my voice and our voice on social media. Use your influence to share a message with your friends, with your connections around the province. And that message is to make sure that we don't let COVID steal our summer, that we can socialize, and we need to socialize safely. Or as I say, we need to play safe and stay safe. Always know who you're with when you're out. Take steps to protect each other so you can spread kindness and joy and not the virus. In the same way that we don't let friends drive drunk or that we use condoms and sunscreen, this is a time where we need to put together the things that we can do to socialize safely this summer. So whether you're on a boat, at a resort, at somebody's house, if you're hosting an event, you have an obligation to keep your gatherings small. We know the maximum is 50, and that's with social distancing. But you want to keep your bubble small, and if you're having others around that are not in your close contacts, which we do when we're out in the summer, make sure that they're small numbers, but also know everyone who's attending and be able to reach them afterwards. That's one way we protect each other. We want to know if we've been exposed to somebody who may have this virus so that we don't bring it home to the people that we love. So the best way to do that is to have a designated contact keeper. When you go to a party, if you're the person organizing it, get a contact information from the people that are there. And then public health can use that, if we need to anonymously send messages to people to make sure they know if they've been in an exposure event. And that way we can find people quickly. We can break these chains of transmission and stop the spread in our communities so that we continue to enjoy each other's company safely. So whether you're at home or on vacation, young or old, we all continue to have a role to play to keep ourselves safe and keep each other safe. And as we have been opening, it doesn't mean that this is over. And we saw from the serology report that was issued this week, most of us do not have immunity right now, and we have to protect each other from another surge. This is why our layers of protection and our rules for safe social interactions are so important. It's what's going to allow us to enjoy our time together in the coming months. So whether you're from BC and you're traveling to experience British Columbia, whether you're here from Alberta or Ontario or from the US, you need to all follow our rules here to keep each other safe. And one way to do that is to make sure that we are having contact and we know the contact information of the people that we're with, even if we just met them. This weekend, if you're planning a small party or planning to go to one, please do the right thing. Socialize safely, play safe, and stay safe so that we can keep our COVID-19 low and slow and enjoy our summer. And let's also remember to be kind as we do this, to stay calm and to stay safe. Thank you very much, and I'm happy to answer questions.